everyone. Welcome to Talk of the Town. We are here at MiraSol Health with the Chief Clinical Officer, Gina Harris, and today we're actually going to talk about expanding into Colleton and Hampton counties with Gina. But first, tell us a little bit about you.
So I have about 23 years of healthcare background, ranging from acute care to hospice care, everything in between. So I'm at hospice care now to really work with this nonprofit organization to really support the communities around us.
And so why is it important to expand into these rural counties?
So both Hampton and Colleton counties have been determined to be very underserved when it comes to healthcare. And so we want to be able to go in there and increase that availability and that access within those counties.
So do you think you can really provide an impact with your services?
Absolutely. We know that Hampton and Colleton County are in the top 20% of poverty and household income. And they just do not have the access that we may have around here. So we just want to be able to provide that.
All right. So as far as staffing, is it important to find individuals to work with you from that local area, Gina?
It is. So we are looking for professionals who work in those areas, basically because we know that they already have those relationships formed. And having those relationships is going to allow us to get into some of those areas that we wouldn't normally go to. Plus, it's important for that community to have a trust and connection with the people that work there.
Right. And so the services you'll be providing will be the whole breadth and depth of what MiraSol Health does in Beaufort?
Correct. All the clinical services plus the spiritual and bereavement and grief counseling, those kind of things too.
And so I'm assuming you're going to work with other organizations and bring other resources to the table to be able to serve that community.
We are going to be meeting with healthcare leaders in those areas and other groups that may really try to support services for the residents of those communities, and we want to create those relationships with those people so that we can serve them better. That's our whole goal.
And so again, you're a nonprofit.
Correct.
And so to be able to bring these services to these very rural areas is just really part of your purpose and your mission. And because they don't have that access to health care.
That's correct. That's correct.
So personally, as the Chief Clinical Officer, how does that make you feel to be able to bring MiraSol Health to these communities?
That's the whole reason I joined this organization, was because of their service to other communities and what they can do to bring the services to them through access, through the people that we have, our volunteer services, our social services. All of those things kind of give this rounded approach to healthcare.
So if an organization or individual wants to find out more information about MiraSol Health moving into and expanding into Hampton and Colleton counties, where can they go?
So they can go to our website at mirasolhealth.org, or they can just call us. Some people may not have internet access, I'm not sure, but yes, they can just call us.
Okay, very good. Well, thank you so much, and congratulations.
Thank you.
To the expansion.
Thank you so much.